is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. United States surgeons successfully gave a pig's kidney to a human in a rare transplant breakthrough, which they hope could ultimately solve donor organ shortages. The recipient was on an artificial life support with no prospect of recovering. The kidney came from a pig that had been genetically modified to stop the organ being recognized by the body as foreign and been rejected. The work is not yet peer-reviewed or published, but there are plans for this. Experts say it is the most advanced experiment in the field so far. Similar tests have been done in non-human primates, but not people until now. During the 2-hour operation at the New York University Langone Health Medical Center, the surgeons connected the donor pig kidney to the blood vessels of the brain-dead recipient to see if it would function normally once plumbed in or being rejected. According to findings from a nationwide population-based cohort study, babies born to mothers with thyroid hormone insufficiency were found to be at increased risk of cardiovascular disease. Using Danish population-based registries, all single-teen births in Denmark between 1978 and 1998 were included in the study. CVD risk was assessed on the basis of maternal hypothyroidism status. A total of 11,281 children were born to mothers with a diagnosis of hypothyroidism. In order to encourage the uptake of COVID-19 vaccination, the Cross River State government, with support from the World Health Organization, WHO, leveraged the polio vaccination campaign by integrating the COVID-19 vaccination. On the 25th of August 2020, Nigeria and the World Health Organization Africa region was certified polio-free after achieving the wide polio virus-free status. However, Nigeria is still combating the circulating vaccine-derived poliovirus type 2. And as a result, necessitated sustained vaccination across the country from January to September of 2021. 22 states reported 327 confirmed cases of circulating vaccine-derived poliovirus type 2. Also, Nigeria is currently combating the COVID-19 pandemic with 209,546 cases reported and 28,032 deaths as of 19th of October 2021, of which Cross River State has reported 614 cases so far. The Director General of the Nigeria Blood Services Commission, Omale Joseph, has alleged that many Nigerian hospitals are giving expired blood to their patients, while others are selling blood donated to them by individuals to keep in their bank. Omale raised the alarm while briefing journalists in Abuja on Thursday after a bill sponsored by a member of the House, Abbas Tajuddin, which President Muhammadu Buhari has signed into law. The bill is to establish the National Blood Services Commission. The DG, while responding to a question on the need to inject sanity into the process of blood handling, utilization and administration in Nigeria, said many officials in hospitals were cutting corners in the blood administration. According to him, safe blood has a lifespan of 35 days, after which it becomes unsafe to use. Omale also stated that some individuals now commercialize blood, donating it for fees ranging from 20,000 and above. He, however, said that the new commission was out to stop the inhuman practices. And the World Health Organization says 180,000 health and care workers have reportedly died from COVID-19 globally between January of 2020 and May 2021. WHO gave the estimate in a new working paper titled The Impact of COVID-19 on Health and Care Workers, a closer look at death based on the 3.45 million coronavirus-related deaths reported globally. This figure, WHO said, might well be at least 60% lower than the actual number of victims. To highlight the need for better protection, WHO on Thursday was joined by global partners working to end the pandemic to issue an urgent call for concrete action on behalf of workers in the sector. Speaking to journalists in Geneva, World Health Organization Director General Dr. Tedros Ghebreyesus reiterated that the backbone of every health system is its workforce. And this is TOS Television Network. You're watching Health 54. We will be right back. Welcome back. You're watching Health 54 on TOS Television Network. Jigawa State Government says it has commenced the administration of cholera vaccine in 3 local government areas of the state. This was stated by the Executive Secretary, State Primary Healthcare Development Agency, Dr. Kabir Ibrahim, at the official flag-off of the vaccine held at Badanda Village, Dusa local government area. He said the federal government has provided about 1.4 doses of the vaccines to be administered to the people from 1 year and above. Dr. Kabiru explained that about 720 people were targeted for the first and second doses of the vaccine in Birnin Kudu, Duse and Hadejia. He said the aim is to curtail the cholera outbreak that killed hundreds of people across the state. He therefore urged people to cooperate with government efforts in curtailing the disease and also advised on maintaining the traditional method of infection control protocols. And the United States Centers for Disease Control and Prevention has approved mixing and matching of Moderna and Johnson & Johnson COVID-19 vaccine for booster vaccination, noting that clinics, pharmacies can start giving them from Friday. Recall that a CDC advisory committee had recommended that Americans be allowed to choose among the Pfizer-BioNTech, Moderna and Johnson & Johnson vaccines as a COVID-19 booster shots. The committee said it could increase protection against the disease that is killing an average of 1,093 Americans a day. The advisory committee made its decision based on data presented by the vaccine makers and the National Institutes of Health study. It also considered the endorsement of similar recommendations by the Food and Drug Administration. A booster of the Moderna vaccine was recommended at least 6 months after people get their second shots, but only for those at 65 and older or 18 and older if they are at high risk of severe COVID-19 or their jobs or living conditions put them at high risk of exposure to the virus. And the chairman of the National Drug Law Enforcement Agency, Brigadier General Buba Marwa, has stated that drug offenders will now get 15 to 25 years in jail and life sentences without an option of a fine. He also revealed that the agency had from January 2021 till now seized 100 billion worth of drugs and arrested 9,355 traffickers. Marwa said this on Thursday during the weekly ministerial briefing organized by the Presidential Communications Team at the Presidential Villa, Abuja. Fielding questions from State House correspondents, the NDLEA boss also revealed that the agency's act under review at the National Assembly would ensure the introduction of drug tests before weddings and recruitment into public roles and offices. And as part of activities to mark 2021 World Diabetes Day, the Olusegun Obasanjo Foundation has unveiled plans to screen at least 10 million Nigerians for diabetes. Addressing the press, former president of Nigeria, Olusegun Obasanjo, said he was diagnosed of diabetes more than 40 years ago, saying he has been able to survive the disease by maintaining good healthy diet and regular exercise. He said diabetes had no known cure yet and had continued to claim lives yearly, advising those living with diabetes to manage the disease well by maintaining good, healthy lifestyle, saying diabetes, although has no known cure, but it is not a killer disease. And before we go, according to figures released on its official website on Friday, the Nigeria Center for Disease Control and CDC confirmed 14 states and the Federal Capital Territory reported 247 new cases of COVID-19 on Thursday, with 10 additional COVID-19 related deaths. According to the latest data by the Disease Center, Plateau State recorded the highest number of new infections with 49 cases, followed by the FCT with 46 cases, Kano 29, Lagos 27, Kaduna 26, Gombe 14, Bauchi 11, Cross River 11, Kwara 11, Rivers 9, Ondo 8, Niger 2, Oyo 2, Edo 1, and Ekiti 1. The health agency said that 247 new COVID-19 infections have brought the number of confirmed COVID-19 cases in the country to 209,960. However, 198,026 COVID-19 patients have recovered and have been discharged in the country. With 10 COVID-19 related deaths reported, the death toll from the virus has risen to 2,850. And that is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, Health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.